students come in and they get to put into action things that they have been learning about in their didactic portion, their schoolwork. They get to apply it. So for today's event, we had respiratory therapy students, ADN nursing students, the 4th semester, their final semester, and then med students from Texas Tech Physicians campus in Odessa. They had to practice giving report, informing the provider about what was going on. They all collaborated together to really take total care of the patient.
That's the collaboration part is my favorite part about interprofessional education. And where our med students actually get the opportunity to see what the role of different healthcare professionals, and that actually helps them to see how it works in real world when they will be seeing patients after they graduate.
You know, we've had different simulations before, but we've never gotten to interact with other people in different professions. So I really liked that it was very interactive, very centered around teamwork, and that we got to see different roles of people like nursing and respiratory therapy that we otherwise haven't gotten the chance to see.
My favorite part of the interprofessional exercise at Midland College is seeing my 4th semester soon-to-be graduating nurses participate in a clinical scenario that involves communication, participation, clinical reasoning, and using the teamwork principle and handling patients who are in serious conditions.
My favorite part was just getting to see everyone to work together. They had the respiratory therapist and the doctors. It's usually just the nurses, and we pretend to call the doctor or the respiratory therapist. So it was good to get to actually see them do their job and what they actually do.
My favorite part is actually what happens next. After they actually go through the scenario, then we do what's called debriefing. So the students are able to comment on their communication, their teamwork, how was the flow, and then they start saying things like, here's what we did right, here's where we could make improvements. And